Hi, I'm Phil Stamp. I'm a clinical safety officer working for the Great North Care Record. I've done that for 3 years or so, and also more recently the regional CSO for the ICS as well.
Hi, I'm Mark Westwood. I've been a GP, worked in the North East for 24 years, involved with Great North Care Record from the onset, and very much involved with Phil around the professional advisory group and Steve.
I'm Steve Foreman. I'm Informatics Manager at Newcastle City Council and have been involved in GNCR for a number of years, representing local authorities and adult social care.
Hi, I'm Julie Taylor. I'm a specialist nurse with Cumbrian Northumberland Tyne-Wear NHS Foundation Trust. Mental health nurse by background with a very special interest in physical health, so very proud to be here, thanks.
Thanks. My name is Ish. I'm one of the general surgical consultants at North East Hospital. I'm also the clinical safety officer for the trust, so heavily involved with digital systems.
Thanks, Lisa. Colleagues, I'm just going to ask an open question. Why do you think GNCR is as successful as it is? What do you think is the specific ingredient that makes us do what we do? Phil?
Should I take that one? From my point of view, so I'm an A&E consultant half my life as well. And I think the teamwork, we've got a very strong team, a very responsive supplier who understands, and personally from my clinical safety hat on, I feel like I've developed a very good relationship with the Cerner team, and therefore when something happens and I put it into a clinical safety analysis and I talk to the supplier and the Great North Care Record, the rest of the team that we work with, we all just get it, understand that there needs to be something done, and there's a drive and an understanding. Things like Melissa's story and William's story at the beginning, we understand the impact of what we're doing to the patients, to the citizens, and I think just the teamwork of it all. I really enjoy working with the team that we have, and long may it continue.
Challenges, so from a local authority perspective and sort of ICB level, we're huge. You know, some ICBs have got 1 or 2 local authorities and we've got 13. So from a kind of connecting into a care record, it's quite a challenge, and we're a big region. But I think we have got a really good history and we've got a regional identity. And from my point of view, I think that's really helped us get to where we've got to, because there's been a real kind of willingness and people leaving their organisational badges at the door really, and kind of collaborating to make it happen. And I think that's a real sort of testament to the effort of lots of people in the room actually.
Thanks to the Great North Care Record, we don't have more stories like the death of William. How do you think we persuade the system to invest in digital, and particularly in this, to try and enable more partners like our local optometrists and many others to be able to connect with the Great North Care Record? How do you think we make that?
It was mentioned earlier that there's some comms going to start, and I think that'll be very helpful in terms of awareness for clinicians and citizens alike, and social care colleagues as well, for an understanding of what's possible. There's a huge variation in digital maturity across this region, across the NHS as a whole, and helping with awareness and helping what's possible, and people talking, this sort of event where you get people together and saying, I can see your data but I can't see your data, and those sort of conversations really help drive the process. I certainly feel that questions like from our optometrist team are gold, and that you want people to say, why can't I see the record that I need to see? We had that with dentistry over the last year, and we've worked really hard with the dental teams and added a lot of dental dentists to now be able to view the Great North Care Record, whereas they couldn't before, and they felt like they were hitting their head against a brick wall, and perhaps some of them weren't asking the right people, or they weren't getting the right answers. But once we started talking to them, I felt like it just helps. So I think whenever anybody says, I need to be able to see this record, as long as they've got a direct care need to see that record, and obviously there's the governance around that we make sure, then the more people who say that, the better. So I think it's conversations, it's networking, it's complaints, it's incidents, it's the whole team, the whole network, the whole region getting together in various conversations and just saying we want to see more, which is happening. So it's great. I mean, BadgerNet, GP Connect, social care, it's all, over the last 3 years, we've had a massive explosion of availability of information, and it looks like it's just going to carry on continuing. So it's a great thing.
As well, it's going to be about keeping it real. It's having that story that we had at the very beginning here, which certainly had me in tears, because I've got my own family links with sepsis as well, so I can understand how frustrating and devastating it can be. But it's about listening to those stories, whether there's the really sad ones like that, or if it's the positive ones where we have made a positive change. And it's listening to practitioners and the patients and the carers and families, outreaching to them to find out what their story is and how it's changed their lives and experiences.
And I think I could just add, just from a relatively short experience working with Great North Care Record, with the, I feel very lucky to be here on behalf of maternity, neonatal folk. They are on the late ward right now, not here, sat talking to you. And they're a hard bunch to please, as I find in my job regularly. And I really hoped it was going to be this big eureka moment of we can see the Great North Care Record, and it wasn't. I really had to go and sit next to them and be like, do you know you can see this by clicking this, and watch it kind of slowly trickle between staff members. But I think when it does, and you kind of put the time and effort into getting that message across, it's then how the people that are here today that aren't on the shop floor can come back and tell those stories and make sure that they are publicised, so that we are kind of, we're helping our colleagues in improving things.
I think if I can just add, I'll probably flip this the other way around. I think we also need to look at the challenges we have in terms of expanding this further. A lot of trusts have got a limited number of digital team members, and when you're trying to expand your services significantly, that's probably one of our biggest bottleneck. Without breaking those barriers, expansion would be difficult. The other difficulty that we often have is, if we look at the digital agenda in most of the trusts, digital often isn't on top of the agenda. There are lots of other things that take priority, even though digital is part of all work streams. So in the D side, we're at the minute having a lot of conversations between two trusts around collaboration, and we've been having these conversations for nearly 2 years. Surprisingly, the digital clinicians or the digital teams haven't yet sat down together to look at how we streamline things. So that's just a glimpse of things, but I think when you look at the Great North Care Record, I'm sure it's the same thing. I was just having a chat with our CCIO earlier on. If we look at how much we are contributing to the Great North Care Record, at the minute we're just contributing to in terms of demographics. We're not contributing clinical letters yet. What are the main barriers? We've got a small team. We've only got 2 clinicians, a handful of digital team members. We've got in excess of 20-25 digital systems. We just can't deliver all that. So we just need a significant expansion and investment on digital infrastructure and team.
Thank you for that. And it is the elephant in the room. What we've achieved as the Great North Care Record with a very small team, I've got awful feedback, is truly amazing. But if we want to take it to the next level, our colleagues at the ICB, through the Provider Collaborative, and also our colleagues in social care, how do we get the investment that we need to truly take this to the next level? Because all organisations are stretched and don't have the resources that they need to deliver what we know is possible. And I suppose the second piece is really imploring to our supplier, Oracle Cerner. So, I think we're on a journey together. I think the conversations that we had last year around GP Connect in the States got the attention, but it's how we make sure that the supplier is truly responsive. So to take Great North Care Record to the level that we all want, including for your service, we need investment, we need skill, we need commitment, and we need resources. But together we can do that. I'm sorry to jump into the ball. Any other questions?
Like, first of all, I think it'd be something to stop and reflect how far we've come so quickly with GNCR. So I think today is a great opportunity to do that. But looking forward, if you had a sort of a GNCR magic wand, what big ticket item would you like to see sort of happen in the future from a clinical point of view? We talk about that next level, but what would really make a difference? I would say nobody in particular, anybody's free to answer that one.
Hi Darren, yeah, I think the challenge is obviously, as Mark said, that actually patients receive care in the NHS, but at the moment that care is naturally to a certain extent siloed, and I think episodes of care that go beyond different organisations are a challenge. And I think the Great North Care Record delivers some of that issue, but I think the thing you're touching on there is about care planning. So when you start off an episode of care planning in one organisation and they're seen in another organisation, they're aware of what's actually happening to a patient. And it's not just the data from the Great North Care Record, we've got a living document to say the patient's involved in this decision-making process. That's the future, I think, and that information has to be held by the patient.
I guess from my perspective, the other bit of it is we are to a large extent at the behest of the different sources of information we have across the region. Structured data is your gold dust for a shared care record, because it means you can display it in a consistent way, and there's such a variety. I mean, we've always had the idea that if we can share it, we should, obviously within usual IG side of things, but and if it's safe to do so. But so we've taken the view of we're sharing PDFs, we're sharing HTML, we're sharing structured coded data, and it's all, and that's often one of the things that people perhaps less positively say about the HIE is that it's a bit of a mishmash. It is what it is, but I think it gets better all the time as the organisations within the region get better. So I would say structured data, drive your own organisations to be able to provide that in a consistent way, and the shared care record will massively leap forward with the more structured data. And just to echo what was just said there, care plans, DNA, CPR, emergency healthcare plan, that sort of thing was actually one of the first things that we talked about when we first started talking about shared care records and the Great North Care Record way back when, with Joe McDonald and team. And we are starting to talk about that, but it depends on the digital maturity of the organisation to be able to share that in a safe way. So it comes down to structured data and digital maturity.
Well, I suppose this sort of social care from a local authority point of view, and then social care in terms of care providers. And I think probably what I would say, probably being involved in the journey of GNCR, and before that trying to sort of share data, I think it's been, I've seen a big change actually, in a real appreciation of the fact that social care is part of direct care. It's not just, this is what the NHS is, and a real kind of broader understanding of social care. Probably when it started the journey, it was like, well, I think we can maybe share things with kind of regulated and registered professionals, which is a tiny proportion of the social care workforce. And so I think there's been a kind of real culture change across the NHS, and certainly in our discussions about the importance of social care. And also, sometimes I think in some of the national narratives you get a sense of, well, we need social care to do this so we can save the NHS money. And the role of social care is not primarily to save the NHS money, it's to deliver care and maximise independence for people. And so I think it's a great asset in our region that we appreciate that as well. I think there are real challenges, particularly for local authorities, and there are kind of budgetary challenges. I know for my own organisation, it feels like every year we're finding another £20 million out of the budget, which is huge. And on the back of doing that for 10 years, every chunk of money is scrutinised, and I think it's a real challenge for some local authorities across the country to join in with shared care records. I think I'm really fortunate in my own organisation. Actually, the reason that I've been on this journey for so long and sort of spent time to kind of invest in it is because we just got it. We saw that this was a really, really valuable thing. I sort of sometimes sort of say this quite often, I think, but where the vision is too small, the cost is too great, isn't it? And so because we had a vision, we saw the benefit of this. I didn't have to present a business case or anything like that. It was just understood that this is a good thing. And I think there's a real kind of cultural thing for us there, isn't there, about actually what kind of care do we want to deliver as a region? Because it's always going to be a challenge to secure funding for new digital initiatives or to do something different that we're not doing at the moment. But actually, if we agree that we want to do the best that we possibly can for our patients and our service users and our residents, that kind of really helps us with some of those economic things. So I think there's a challenge there for local authorities. I think there's lots of positives going on as well for local authorities and also for social care providers. So a lot of investment and impetus around digitising social care records for social care providers, and also for kind of core minimum data standards, and that's going to be really, really helpful in sort of enabling some of those care providers once they've got digital care records in place to contribute. So I think there's lots of potential with social care. I think there's quite a lot of appetite, and there's some sort of practical things to work through.
Thanks, Stephen. It was interesting listening to you talk about a social care perspective there, because from Hartlepool's point of view, we've just committed, I've just been talking to Jill about committing to the Greater North Care Record. We've always thought it was the right thing to do. I think the challenges we have are great, particularly in small councils. Our budgets are small sometimes. And I think what we probably know is we've got to be creative and innovative, and that's my sort of question. How do we continue to be creative and innovative and not just do what we're doing with the plan, but we continually be thinking differently how we can do things differently that will keep meaning we can be more efficient and do things better.
I mean, I'm happy to start on that because, again, sort of coming back to Great North Care Record, I remember kind of quite at the start. I remember sort of being in a room with various colleagues, some who were in this room, and saying, "Oh, wouldn't it be great if we had a shared care record or whatever?" And then I remember being in a room about a year later where we had exactly the same conversation, and a group of people said, "We're going to make that happen. I'm going to make that happen." And I'm going to do this. Who else is on board? And so I think, how do we keep on innovating? I think it is about having that attitude of saying, wouldn't it be good if, well, right, what can we do? Let's make it happen. And I think, again, we're really blessed in this room and in the region of kind of people who think innovatively, who are willing to try and make things happen. And I think we just need to keep on doing that. And that kind of partnership that I talked about before is a really important bit of that, isn't it? Because we can achieve kind of more together than we can individually. And, the sort of innovative solutions we want to develop are kind of region-wide. They're, what the people of Hartlepool need are the same as the people in Newcastle. So, Graham Evans is brilliant at talking about, let's do things once and let's kind of learn the lessons and sort of share the learning. So I think it's things like that.
I agree, and I think it's getting those people who are innovative to be front and centre and get them supported to make sure they can do that.
And I think it's just, like you said, it's not necessarily just expecting the people that we think are innovative to be the ones that are, because there are plenty of people out there that will be working clinically and not be in these forums that will have great ideas. I was talking to someone earlier, a really good example of how our trust is managing a bit of non-recurrent funding that they've got, and that is we'll just ask all the midwives and the nurses what do they want. And it's worked really well, and it's not, it doesn't have to be groundbreaking, but you get these ideas from the people that have these niggles that you might be putting up with something. I find, midwives that are putting up with something that really bugs them, and then I'm just so happen to be sat next to them when I'm working clinically, and I go, "Oh, do you know that you can do this way?" And it's, and they didn't know, and it's just sharing that information. So something I think that we could really take forward. And there are all the struggles that there are with getting those voices heard, but making sure that we put plans in place or forums in place that we can hear those people's and their good ideas, because they're as good as ours.
And I think that's really important in terms of that route, the innovation. We've kind of lost that forum, haven't we? How would you suggest something innovative to the Great North Care Record today?
I just wanted to add, very, very supportive of colleagues in the south of the region to embrace the Great North Care Record. We do have I feel like we have a bit of a north-south divide within our region still, in that, and it may be, but I guess you were talking about that before, that you need sort of a critical mass of information to make it useful. And I think the more organisations within the south of the region that embrace the reality of the usefulness of this tool, the better, because there is a bit of a disparity at the moment in terms of the north and the south of the region. So I'd strongly encourage colleagues such as yourselves, Hartlepool, Middlesbrough, Stockton, etc., to carry on.
Hi, sorry, I'm Graham Earl from the Tees Valley area and work for the ICB, and I think just to add to that, a bit of a challenge to the system. How do we support those colleagues and those local authorities that potentially don't feel they have that ability to put that investment in? And there's a little bit about changing hearts and minds, and pinch on Graham Evans' terms of seeing it as it's an investment, not a cost. But if the ability isn't there, sometimes you can end up in a postcode lottery that the information's being shared in a certain area just from an affordability point of view. So I suppose the challenge to us as the system, where we do recognise the benefits, how can we support those that feel that they don't have the funding available to do that, to be able to maximise the benefit for the whole population of the ICB and the area, North East Northumbria. So it's a challenge to all of us, rather than yourselves up there.
I think Jill and the GNCR team as a whole have been very confidently pushing out the success stories and always looking for nice success stories and examples of how it can be useful in different organisations, different areas of care, social care, whatever, which is, that was part of the ambassador programme, and getting people to provide stories, to point out to people with the purses that this is actually a useful tool. So hopefully we'll be seeing a lot more of that with the comms over the next year as well, which will perhaps help support your goal for getting the money.
Can I partly comment and maybe a question, Phil? At the minute, so I'm one of the emergency general surgeons, do a lot of acute stuff, and most of the time we refer patients to Freeman, Newcastle hospitals, and those are the ones that we really want to see. If I talk about the wider clinical groups within, for instance, in my trust, most of the clinicians use Great North Care a lot. We regularly, patient safety panel meetings, etc., we regularly refer to information from the Great North Care. I'm just wondering, do we really, if we need south of the river to be contributing, should we be making a bigger voice to say we need to look at data from your region? Because I very rarely hear that conversation that we need to see data from that side. So even today, we've not echoed that. So it's just a question rather than a...
I guess I was talking about digital maturity and the variations. It's a tool at the behest of the sources of information and the availability of that information. So some organisations have a single EPR, and they can, and the system itself is designed to share structured data, and that's fantastic. And other organisations have multiple tools which work for them, but wasn't necessarily designed for sharing outside of the organisation, and it's encouraging the direction of travel to be in a way that allows sharing in the best, safest way. So, I mean, North Tees is on that journey, and a lot of other organisations are on that journey as well, and which means that the GNCR will gradually get better as people. But I think, as you said earlier, that we are struggling with the number of digitally and informatics sort of team sizes that we have in the region, and that is one of the bottlenecks.
Grassroots communication and understanding, and I think we need to corral the enthusiasm and ideas and turn that into formal proposals so that we can actually make progress in these areas, but that will require the support of all organisations to get that equity across the patch. So thank you very much for your time, thank you very much to the panel,